Hey everybody, Dr. Shankman here from PremierOne Implant Centers. I wanted to do a quick video to show you all the safety measures and precautions that we're taking to protect you and your loved ones, as well as our staff and our families. So I just wanted to give you a quick tour of the office and show you some of the safety measures we've implemented to do this. So I just wanted to let everybody out there know, if you're a new follower to us, that PremierOne Implant Centers is formerly Attleboro Cumberland Oral Surgeons. We are in the process of changing the names and actually had everything ready to go, and then the whole COVID-19 coronavirus thing hit, and that kind of put the kibosh on us making the grand announcement and getting our signage squared away and all that. So I'm going to show you around a little bit. You're going to see Attleboro Cumberland Oral Surgeons in some places. Now that everything is kind of reopening, our signage is back underway, and everything will reflect PremierOne Implant Centers as soon as that's all done. So I just wanted to show you that. So let's take a little stroll here, and I'm going to go outside for a minute. So the very first thing that you'll see is we have some signage on the front door, and I don't know if you can see that okay, but it talks about only scheduled patients in the office and minimizing any escorts or accompaniment. So no kids of parents, no escorts for people being sedated. They all wait out in their car. And one of the things that we're doing is people are going to be out in the parking lot. They'll call us, let us know when they're here. We'll have one of our front desk people come out to the car, do a pre-screening check, which was also done prior to making the appointment, but they'll do a new pre-screening check, and they'll have their temperatures taken, and then they're escorted inside once the operatory is all ready for them. So we also have signage on here that talks about what the pre-screening business is. And so if you've had cough, fever, chills, news, shortness of breath, exposure to anyone who's been sick or has been exposed to COVID-19, we're asking that you not enter, and we're screening to make sure that those folks that may be asymptomatic also are screened out. So we have the same signage on the front door. Like I said, Attleboro Cumberland Oral Surgeon signage will be going away, but we have those same messages on our door here. The assistants or front desk staff will escort the patient in. And one of the things that you'll see right away is we have a little station set up here. And unfortunately with the video, I can't turn things around, but we've got the little station here, and this is where temperatures are taken. People have hand sanitizer to clean off their hands. And we have this nice little sign that kind of talks about, making sure that you're taken care of, and, that you haven't been exposed to any of these things, and that your symptoms are not consistent with COVID. So we've got the little station. You can see we installed some plexiglass around the front desk area to protect our receptionists and front desk personnel, and really minimized all the signage and whatnot. We have, I don't know if you can see that over there, but we have a pre-screening form that our staff will ask the questions, fill out, and we keep a log of every patient that comes in, if they had any symptoms, if they had any fever, and whether they were seen or sent home or sent for testing. So every patient that comes in, if they don't come in with their own mask, gets a surgical mask and gloves, and go back straight to the operatory. The other thing that we recently put in, I don't know if you can see that right there, it's an air purifier, and there's 2 of those for the main bulk of the office. Our office is pretty small. It's about 1,500 square feet, and each of these does about 840 square feet. There you can see. This is kind of the model and some of the stuff that it does. But we've got 2 of these babies running pretty consistently throughout the, running consistently throughout the day. to kind of turn over the air in here, and if there are any respiratory droplets with COVID, then those will get filtered out of the air. As you can see, I'm wearing my mask, but I'm in the office alone right now. So, but of course, everybody in the office will be wearing masks and booties and hats as well. So, and then one of the other cool things, this one not necessarily for patients, but this is a pretty slick little device. Let me see if I can angle it right. But that's a UV light and produces ozone. And they're pretty small. We have about 7 of them. We spread them out throughout the office, but we put them primarily at the workstations to completely sterilize the keyboards, the mouse, computer screens, whatnot, their immediate work area, so that when they come in the next day, we actually set those up at night before they leave. Those get turned on. They run for 15 minutes, turn off, and that sterilizes the workspaces for the staff. So those are primarily the things. Then if we come through the office, you can see pictures of all our staff and kids. Very friendly, family-friendly environment. Just a quick perusal here. This is here's our prime scan. This is where we can do digital impressions for you. We do that a lot for implant treatment, and we've got our sterilization area. Not really much has changed in the sterilization area, because we already did all the things that were really necessary prior to COVID in the sterilization area. So pretty much that routine is the same. We actually took our recovery room, or what used to be our recovery room, and right now we've converted it into a PPE room, personal protective equipment. And you can see some gowns laid out, and all the necessary personal protective equipment, so that when before we go in to see patients, we gown up. We all get hats and booties and gowns. We use a N95 mask followed by a surgical mask over the top of that, either with a shield on the mask, like these, like this one sitting here. I don't know if you can see that. So that has a shield attached to the surgical mask, or a face shield like this. Goes over you like that. So everybody has face shields, double mask, gowns, hats, booties, gloves, of course. So we feel very safe, feel very protected. We make sure that between patients, you guys are safe and protected. Everything gets scrubbed down with disinfectants very frequently. All the doorknobs, all the countertops, anything that can be repeatedly touched pretty much gets washed down and disinfected pretty continuously. And then you saw that we had the air purifiers for the office, but this is our main surgical operatory, and I'll kind of come in for you here. And in our, I got to turn things around. So in our main surgical operatory here, we have a separate air purifier that runs pretty much consistently throughout the entire time in that room. That's right now during urgent care treatment. We were doing emergency treatment for about a month, and now we're doing either emergent or soon to be emergent, which I'm calling urgent types of treatment. Everything pretty much gets done out of that one room, and we have a separate air purifier for that room to take any respiratory droplets out of the air and make it safer between patients. And of course, that room gets scrubbed top to bottom between every patient. And like I said, doorknobs and things like that all, are, where am I here? All the doorknobs and whatnot get wiped down, all the countertops, and, just disinfecting all the time now to make sure you guys stay safe. So just wanted to do a quick, view of what we're doing to, take care of you post-COVID, now that we're reopened for urgent care. And hopefully here in a couple weeks, we'll be opening for elective surgery again, where we can do our implant treatment and our wisdom teeth for kids that aren't having any problems right now, but to prevent problems in the future. And so look forward to seeing you in our office at PremierOne Implant Centers. I'm Dr. Mark Shankman, and thank you so much for watching. I appreciate it. Take care. Bye-bye.